My name is Kjetil Garborg. I'm a gastroenterology fellow, currently affiliated with Oslo University Hospital in Norway. On behalf of my co-authors, Drs. Kaminski and Wronska from the Maria Skłodowska-Curie Memorial Cancer Center and Institute of Oncology in Warsaw, Poland, Dr. Lindenburger from the Department of Medicine, Sørlandet Hospital in Arendal, Drs. Wiig, Hasund and Holme from the Department of Medicine, Drs. Britta, Kleist and Løvdal from the Department of Pathology at Sørlandet Hospital in Kristiansand, and Drs. Kalager, Hoff and Bretthauer from the University of Oslo, all in Norway. We would like to thank the editorial office of endoscopy for the opportunity to discuss a recently accepted manuscript entitled Water Exchange versus Carbon Dioxide Insufflation in Unsedated Colonoscopy, a multicenter randomized controlled trial. Colonoscopy can be an uncomfortable and even painful procedure. Although sedation and analgesia may effectively reduce discomfort, it is also associated with some disadvantages. For example, there is a small risk of adverse events related to sedation. It also increases costs, and for patients, the inability to drive after the procedure, a need for escort, and inability to return to work or other daily activities may be inconvenient. Unsedated colonoscopy therefore has several advantages, and it is the norm at the centers participating in this trial. Our motivation to perform the trial was to assess whether a recently described refined water-aided technique for colonoscope insertion would cause less discomfort during colonoscopy than the current gold standard technique with carbon dioxide insufflation. According to the European Union guidelines for colorectal cancer screening, carbon dioxide is the preferred insufflation gas for colonoscopy, based on trials showing that carbon dioxide insufflation is associated with less discomfort than air insufflation, primarily by reducing post-procedural bloating and discomfort. Water exchange is a technique for colonoscope insertion involving simultaneous infusion and suctioning of water to identify the lumen ahead and clean out dirty water. The technique has been shown to significantly reduce procedural discomfort compared with air insufflation in several trials, but comparisons between water exchange and carbon dioxide insufflation are lacking. Our aim was to directly compare water exchange with the gold standard carbon dioxide insufflation with regard to procedural pain during colonoscope insertion. 6 endoscopists at 3 centers performed the trial procedures. We randomly assigned 473 patients undergoing colonoscopy for colorectal cancer screening or polyp surveillance to either water exchange or carbon dioxide insufflation during colonoscope insertion. Patients were blinded to the technique used. They were not sedated before the procedure, but on-demand sedation was available and was used in 6% in each group. The groups were well balanced with regard to baseline characteristics. There were 49% female patients in each group. The primary endpoint was the proportion of patients reporting moderate or severe pain on a 4-point verbal rating scale, with the categories no pain, slight pain, moderate pain, or severe pain. After the procedure, a secretary who was blinded to the patient's group allocation asked all patients to indicate how painful the procedure had been. The proportion reporting moderate or severe procedural pain was 21% in the water exchange group and 27% in the carbon dioxide group. This difference was not statistically significant. In secondary analysis, however, we found that pain scores overall were significantly lower in the water exchange group, and a larger proportion experienced no procedural pain with water exchange than with carbon dioxide insufflation. The proportion with no pain were 44% with water exchange and 31% with carbon dioxide insufflation. Additional findings were that there were significantly more cecal intubation failures due to pain with carbon dioxide insufflation, and the need for external abdominal compression was significantly higher in the carbon dioxide group than in the water exchange group. Polyp detection rate was also significantly higher with water exchange than with carbon dioxide, but when analyzing separate histologic subtypes, the differences did not reach statistical significance. Cecal intubation time and total procedure time was longer with the water exchange technique. This may reflect a limitation to our study in that all endoscopists were far more experienced with carbon dioxide insufflation than with the water exchange technique. The observed results may therefore fail to reflect the full potential of water exchange for colonoscope insertion. Future studies, both observational and prospective, and including larger patient populations, may shed new light on the full potential of water exchange colonoscopy. In conclusion, we did not find a significant reduction in moderate or severe pain. However, pain scores were overall lower with water exchange than with carbon dioxide, and it seems to be a suitable technique for colonoscope insertion to reduce patients' discomfort in unsedated procedures. Thank you.